Now, one further question that comes in when we're talking about evaluating psychotherapies is, of course, the logical one when you begin to get a grasp of how many things there are out there, models and so forth. The logical next question is, which one? Which one is the most successful? And essentially, the way we go about studying this is we do what's called randomized clinical trials. And essentially, we assign people to randomly to either a therapy waiting list or a no therapy waiting list. And of course, the people that are in the no therapy one are our control group. The ones that are in therapy are the ones obviously in the experimental group. And then essentially what we do is we take and subject the data that we get from that to something we refer to as meta-analysis. In other words, we take a lot of different experiments, research, and subject them to a statistical procedure that combines the conclusions of all of these research studies. And some of the conclusions that came out were basically three different conclusions. First of all, people who remain untreated often improve. So we find that untreated people still improve. The key component that separates them from others, as this little diagram makes clear, is time. You know, if you take from here to here, there's a passage of time. The people who are untreated, they're closer. The number of people who have a poor outcome to a good outcome, 80% have poorer outcomes than the average treated person does. So you have a better outcome here for the average psychotherapy client versus the person who is the average untreated person. So untreated people do improve. Another conclusion that came out of these studies, these meta-analysis studies, is that those who receive therapy are more likely to improve with less relapse. So treated people are increased chance of improvement and decreased chance of relapse, so difficulty re-emerging at some later point in time. The third thing is, the third conclusion that came out of this is that when people seek psychological treatment, their search for other medical treatment declines compared to with their counterparts on a waiting list. So when they seek psych treatment, I'll just shorthand it here, they don't look for treatment anywhere else. They typically will look at psych treatment as the end of the line for the help that they get. On the other hand, people that were in the untreated category kept looking. And so that would suggest that people that got psychological treatment had some measure of satisfaction, enough to not look anymore. Now, the bottom line when it comes to evaluating is no therapy has been shown best in all cases. Shown best in all cases. So there's no one therapy model that works with everything. Essentially, there is some therapies that are, however, better suited for particular disorders. So some are better than others depending on the disorder. So for example, the disorder, we'll put disorder here and we'll put therapy here in terms of what's better suited for what. And essentially we put mood disorders in here, specifically depression and those sorts of things. And what is typically found to be the most effective is cognitive or CBT. We put anxiety disorder in over here, and what oftentimes is the most effective is behavioral oriented therapies, because they remove or they engage in the counter conditioning, which we referred to earlier. One of the categories, and so mood and anxiety, that captures a lot of them. The last thing I want to mention to you is evidence-based EBP, which means evidence-based practice. Based practice. And basically this involves clinical decision making that integrates the best available research with clinical expertise and what the patient actually presents. And so this is a very up and coming, momentum building movement in psychology today, is using more and more evidence-based practices, and insurance companies are demanding it, and essentially clinicians who are trained in these particular treatment models are the ones that are probably getting more referrals from insurance companies in particular because of their expertise in this particular area. Now let's turn our attention a little bit to alternate therapies, which I'm sure you probably have heard a little bit about. And we'll look at alternate therapies and the commonalities among all psychotherapies in the next video.